Welcome to It Comes In Pints, a Seattle Study Club podcast where we will explore a myriad of topics: clinical, health and well-being, psychological, education, business, and much more. I'm your host, Greg Tice.
I'm David Schwab, and what I do is I'm a professional speaker and a consultant and a coach for dental practices. And when it comes to dental practice consulting, what I do is I help practices educate their patients, train their teams, and grow their practices.
I want to welcome everyone to the latest episode of It Comes In Pints, a Seattle Study Club podcast, with your host, me, Greg Tice. And joining us this time is the inimitable Dr. David Schwab. And David, we go back a long, long ways. I was trying to think this morning when we first met, but it had to be 96, 97?
Well, you would know the last time the Seattle Study Club had the meeting in Seattle. Was that 98?
98. Yes, 1998.
And
okay.
That's when I met you. Yeah.
Yeah. So long time. So forewarning everyone, we're going to go off the rails with this one. So, now, to start this podcast, as we do with everyone, because I really want this to be more like you and I are sitting together in a pub and not online talking to each other via video. So to do that, we have to have a drink together. So what did you bring to enjoy today?
I brought a Heineken Zero.
Ah, very nice. Very nice.
Yeah.
Well, I am going to go a little more challenging. A little Macallan 12. So we'll open this and pour it, and then we'll cheers, and we'll get started. So set that aside, and cheers, my friend.
Cheers. Cheers.
All right. All right. So here's where I want to start, because your background, I think, is quite interesting. You have worked at the ADA, at the American College of Prosthodontics, and I want to talk about that a little bit, but I want to hear the story that I've never heard. How did you get into dentistry in the first place?
My good fortune, I guess. I was working at the ADA. I got to work at the ADA because I was finishing my graduate degree, PhD in English from Northwestern. And somebody told me that there was this job opening there. And long story short, because I knew somebody, I got an interview. And when I got the interview, I was pretty impressed. I didn't know the ADA had their own building. I didn't know how big a deal it was.
Right.
And I went in there, and they were looking for somebody to run their accreditation program. When I say run it, I mean administratively run it. They obviously had dentists doing general dentistry and oral surgery and all the specialties, perio, going out and for accreditation of programs, but they needed somebody to administratively run it as sort of an education person. And that's what I did. And it was sort of my residency program, because for 3 years I was flying all over the country learning about dentistry.
That's amazing. So you were there for 3 years?
Yeah.
And then...
Well, I was there for 3 years in that job. I was there a total of 6 years, because when I left that job, I was promoted to running the seminar program, which is everything except the annual session. We had seminars all over the country and sort of incentivize the local society so that they could make money on it or break even, whatever they wanted to do, sort of a business within a business. But by the time I left, I was director of marketing there.
Right. And then you executive director at the American College of Prosthodontics,
yeah.
Is that right?
The American College of Prosthodontics at the time had an office in San Antonio, Texas. And I'll try to make this a 20-second story. It's about a 2-hour story. But they were not on a co-equal status with AAP or AOMS, because there were a multitude of prosthodontic organizations. Right. But the American College was the only one that was composed only of specialists. So it made sense for them to take that role. So the accomplishment there was getting them, along with a lot of other people, a lot of work, getting them recognized. And once they were recognized, I opened an office for them in the ADA building and built up a staff. And then we could communicate with all the other specialties.
Okay. And how long were you at ACP?
About 6 years. And then but I was always on a consulting basis because I said, you guys, you need like a lobbyist. You need a lobbyist in Chicago to push your interest. But by the time I left, it had grown into more than a full-time job. Plus, I was already doing my speaking and consulting, and I said, I can't have all these full-time jobs. So they were very nice, and I said, I really need to give you lots of notice, but I need to go on and do my thing. So I left and did full-time speaking and consulting.
So at the time, was the speaking and consulting, was that a side gig for you and ACP was the primary, and it blossomed? How did that come
I
about?
was doing both of them kind of a lot.
Okay.
And by the time I left, I said, listen, you're recognized, everything's good. You can have somebody else come in and twist the dials, but I gotta go do my thing. So it was great, but you learn a lot about organized dentistry and about everything else. I mean, when I was at the ADA, I was one of 400 people. When I was hired by the ACP and I was the executive director, I mean, every question came to me. So that was, and I was busy, getting resources and putting things together. So, but it was great.
What a great learning experience, though.
Oh, it's wonderful. The whole thing. ADA was great and ACP was great. But I'll tell you, doing a lot of lectures all over the country for Seattle Study Club is fantastic too, because you learn so much.
Oh yeah, 100%. And obviously you're very busy on the marketing, consulting, speaking side of things. But your take is a little different, especially when I think about marketing. When I see you up in front of a group teaching or when you're consulting, you don't talk about clicks and likes and so talk to me a little bit about your approach just from a marketing standpoint.
Well, it's really a marketing communication approach because obviously all those things are important. You want to get clicks, you want to get likes, you have to have an online presence. I mean, all those things are terribly important, but it comes when you get right down to it, it's a communication business. So being able to relate to people, being able to explain things to them in a way they can understand, following up with people in a way that's extremely low key, very, very subtle, but on the other hand, methodical. So we're following up with people and not letting things get away. And there's a lot of team training that goes into this. There are some fantastic people in the Seattle Study Club network, but they will tell you they've got great teams, and they do. But all those teams need to be trained, and we can't assume anything. And I'll just tell you, assistants have usually, not always, a formal training program. Hygienists certainly have a formal training program. People work at the front. Sometimes it's just on-the-job training. Now, they may have great backgrounds. They may have great customer service sense, but let's not make it up as we go along. Let's get some training here.
Yeah, absolutely. I would put the way you approach marketing and communications, and I don't mean to use this term, but I can't think of another one. It's really a holistic approach because it's about the entire engagement with the patient, and it's not just advertising or marketing or get them to call or just answering the phone. There's a whole continuum of activity that needs to be dialed in.
That's true. And many times somebody will hire somebody to do the conventional marketing, get the phone to ring, and the phone will ring. But then what do you do next? I mean, I've seen marketing programs where there's all this money that was spent to get the phone ring, but not $1 on what happens when somebody picks up the phone.
Yeah.
So, we've got to work on that.
What do we say?
Yeah, what do we say? And those patients who come from those phone calls are not the typical patient. Patients who come from referrals, you sort of start on third base. Patients who come from the internet or advertising, their dental IQ could be all over the place. Their background could be all over the place. So you have to be able to sift and sort that. So it's a challenge, but it's doable.
Yeah. All right. So I've wanted to ask you this for 18 years.
This will be good.
Anyone who's heard you speak knows their belly's going to hurt before the end because they're going to be laughing so hard because you're entertaining. The humor is at a level that is subtle, but you're literally laughing out loud during the program. But I know that anybody who's heard you speak will also recognize the name Mrs. Higginlooper. And I have to know, is she a real person, like your kindergarten teacher or something, or did you just make her up?
Well, you know me well enough to know I make everything up, That's the wonderful thing about being a professional speaker. You don't have to do anything. You just have to talk about it. It's great.
Yeah.
But I'll tell you what happened. Way back when I was at the ADA and I was very young, I went to a practice management course, and the speaker was quite good, and he was talking about Mrs. Jones all day. And Greg, when I tell you he said Mrs. Jones in every other sentence, I am not exaggerating. And the Mrs. Jones count per minute was off the chart. And by the end of the day, I thought to myself, I am so sick of Mrs. Jones. There's got to be somebody else. So I went out speaking, and it was Mrs. Hickenlooper, and people enjoyed it. And I'll tell you a funny story. When I wrote my book, and I had the acknowledgments, I almost put Mrs. Hickenlooper in the acknowledgments.
Oh, you should have. That would have been great.
The only reason I didn't is that I didn't want to detract from the real people I thank, like you. I thought that wouldn't be fair. But yeah, so she's been with me for years. And I'll tell you one more quick funny story. I got a call once from a dentist I knew. I think he was a Seattle Study Club guy. And he said, "You'll never guess who's on my schedule next week. Mrs. Hickenlooper."
No.
Yes, he had a Mrs. Hickenlooper. And so wait, you know what I told him? I said, "Well, I referred her to you because you're the best in your area."
And please send me a picture of the screen.
No, I didn't want to ruin it, you know. Yeah.
That's a perfect segue. You're an avid writer. I mean, I can't think of the week of the month I've turned around and there's not another article from David Schwab, because you're prolific at writing and the content is phenomenal. But before we go to your book, I'm curious, what are you reading right now?
Oh, I'm reading. I try to read an eclectic variety of things. I mean, I read history books and everything else. I read business books, and I read things about, I just read a book about AI, and so I'm trying to read all this stuff. And I also glean a lot. I read books a lot, but I also glean things from little articles. And I say, there's a little tidbit I didn't know, and if there's a way to relate it to dentistry, I'll find it.
But if I showed up in your house today, what would I find on your nightstand? What are we reading right now?
Find my alarm clock and my iPad, because all the books are in my iPad. No, I lots of books. So I just finished Crime and Punishment, and a real light
back
read.
to a classic. Nice.
I went back to a classic. Yeah, I won't want to give it away, but the guy did do it. No, I was interested. There's all this philosophical stuff I got interested in, and I like history. I like the turn of the century history, turn of the last century, 1900, when all the technology came in and the entire world started to change. I think there's a lot of parallels with our time. So I like that sort of thing. And I'm also, I like any kind of good writing. Somebody's got something about, a good mystery or a story, I'll read that too.
Brilliant. All right. So let's get down to it. This is the new book.
Yeah, that's
Dental
the new book.
Communication Advantage. The spine is broken. I've even got some pages dog-eared that I'm going to ask you about. So
Okay.
I've been reading it. So it was just released.
Yeah.
You cover a lot of territory in this book: messaging, phone skills, creating value, fees, insurance, hiring, culture, hygiene, bringing in a new doctor, et cetera, et cetera, et cetera. Let's start here. Why did you write this book?
I think I wrote it because I was asked to, because I would do a lot of speaking, and people would say to me, "Do you have a book?" And I always said, "Well, I have a lot of articles," which you alluded to, but I didn't have a book. And I thought, I do need to have a book. So what's interesting, because I've traveled all over the U.S., I've lectured a lot in Canada too, and outside the U.S. too, but traveling around the country, you learn a lot. And I thought, okay, I can take a lot of the stories and a lot of things I've learned, good, bad, or indifferent, and all the things I talk about in the lectures, and that you can't cover everything in one book, but I tried to be comprehensive.
Well, and I think there's some brilliance in that, because you do, even in your programs, you cover a lot of territory, but people walk away with dozens of takeaways, dozens of things they can implement immediately in their practice. But you and I both know that it's no different than sitting and watching television. It becomes in one ear and out the other unless there's follow-up and review. And the book gives anybody in one of your courses the chance to go back and go, okay, I remember he talked about fees. I want to go read about that again to sort of reignite that direction for me. So I think that's great. Now, given the multivaried topic areas in the book, you cover so much. Why was it structured this way? Because there's a cadence and a structure to what you've developed here. What's the thought process behind that?
The thought process was to sort of make it little mini sound bites, so to speak, and to have at the end of every chapter a sort of mini staff meeting. So it says at the end of every chapter is a section called Your Turn. So apply what you've learned, and here's some thoughts to help you. Here's some questions. If you want to have a team meeting, a good team meeting, a substantive team meeting, it's laid out for you. And part of it is review, and part of it is discussion. What do you guys think?
Yeah, there's a great flow to the book. It's organized from start to finish in a natural progression of items. So there's a story or a through thread there. But it's also kind of like a reference book, meaning if I want to go back and remind myself on the insurance component or whatever it is, I don't have to start at the beginning of the book. I can pick up where a little piece here or there if I choose to.
Yeah, I mean, I say this on my website, davidschwab.com. I say, hey, go to the book and read it as a guidebook, read it as a reference book, or read it as a book cover to cover with stuff in it. And however you want to use it, dip into wherever you want. You don't have to read it chronologically. There's one topic that interests you, go for it.
Was there a legal challenge to calling it the Hitchhiker's Guide to Dentistry? You called it a guidebook, so
there were a lot of legal challenges to a lot of titles. Let's just put it that way.
Yeah, absolutely.
But I think Dental Communication Advantage works great.
All right, I want to ask you about one section in particular. In chapter 8, you talk about the elevator pitch, which was eye-opening to me because, look, I've been doing this not quite, but nearly as long as you have. And I have never given a lot of thought to the conversations that Fred Ebsworth might have with somebody at a wedding or at the grocery store or wherever. The elevator pitch from a clinician, from a dentist. And one of those in there, and you give actually examples of, depending on what kind of clinician you are or what direction you want to take, here's how when somebody says, what do you do? Instead of saying, I'm a dentist, you might say, I'm a general dentist. I'm going to read verbatim what you wrote. And I have a passion for my profession. We offer comprehensive dentistry, and the practice grows by word of mouth referrals. What questions do you have about dental problems that I can answer for you? That stuck out to me because of Seattle Study Club's focus on comprehensive dentistry. What's been your feedback from people who are doing that? Do people start to ask, what is comprehensive dentistry? What's the difference between that and regular
Well, the whole idea, they do. The whole idea is to be a conversation starter. And I think to back up a little bit about the elevator pitch, if somebody says, some dentist, or it could be staff too. I do a lot of work with the staff. It could be the assistant, the hygienist, anybody. But let's just go with the dentist. Somebody says at a social event, and they say, what do you do for a living? If someone says, I'm a dentist, it can be a showstopper because people don't often have positive associations with dentistry. Or it can be sort of oh, okay, I get it. And whatever my preconceived notions are, they just kicked in. And by the way, what do you think of the weather? I mean, we're done with that conversation. But if someone says, I do comprehensive dentistry and I do this and I do this, and then people start saying, well, what does that mean even? How does that work? And it gets into a conversation. Now, some people don't want to have, honestly, at a cocktail party, a 10-minute conversation about dentistry, but they are interested in, and then someone says, well, what question? I've always wondered about this, and I heard this and I heard that. Now they're having a little conversation. Even if the conversation only goes on a minute or two, they go back and they say, I met this person, really nice person, happens to be a dentist. It does comprehensive dentistry, which is kind of interesting. And turns out, this person, even though they're a specialist, they're accepting new patients, or they're a general dentist, they're accepting new patients. It's like, wow, they got something out of it. And I will tell you just very quickly, if you look at all the ways to get patients, word of mouth within the practice, and maybe you can do advertising and the internet works for you, those are all fantastic. But we're always looking for one more way, right? In other words, let's diversify the portfolio a little bit. And if somebody's just a dentist and they're going around in their normal life and social circle and they say some of the right words as opposed to some of the stop sign words,
yeah,
all of a sudden they pick up a new patient.
Yeah, because that person talks to another one. Whether that person becomes the patient or not, it allows the conversation to move away from, oh, I've had some pain back here. And if they haven't, then the conversation's over. To wait, you're a consultant? Like if I was having that conversation with you, what does that look like? Like you
Right.
work for Deloitte? I don't
Yeah.
understand.
Right. Yeah, Greg, there are certain dentists, and we know them, that you could lock them in an empty room, and they would come out with 3 patients. And there are other dentists we know, you could lock them in a room with 100 edentulous millionaires, and they couldn't find a patient.
Yep.
So it's part of it is now the interesting thing is this is that what you focused on is what I call dentistry in the wild, because dentistry in the controlled environment in the office, they're great. They'll talk to the patient, educate, everything's wonderful. They do a fantastic job. But put them outside of that comfort zone at a social event, and somebody says, "What do you do for a living?" And it's almost this mumbling apology as opposed to, I got this great message and love to talk to you about it.
Yeah, but you have to think about that, right? That's not a natural. The way at least many of us were raised was to be humble. Oh, here's what I do, right? I'm the COO, I'm a consultant, I'm this, I'm that. And that's the end of it. Doesn't open a conversation. But I do aesthetic dentistry. Oh, really? What is that like? The extreme makeover, or this or that?
Could
I
be,
do
yeah,
comprehensive.
absolutely.
But it starts some interest and some connection. I love that. All right. So the book is fabulous. For those that aren't readers, what would you say are the 3 most important takeaways from the book?
Well, if I had to pick a few takeaways, I would say, I talk a lot about the easy verbal skills, easy once you know them. And I'll give you just a few examples, and some are sort of humorous, but they're on point. And because I hear these all the time, I hear the term dental insurance in practices all the time, and I think it would be much better to say dental benefits, because dental insurance sounds like medical insurance, and medical insurance and dental insurance are not similar at all. They're about as similar as a lion and a lionfish. They sound alike, but they're totally different. So we want to say, want to talk about dental benefits, which are, and instead of saying to somebody, well, this is not covered by your dental benefits, your insurance doesn't cover this, that's a big stop sign. You can be honest and get the same information out and say it a little differently. The proposed treatment is beyond the scope of dental benefits. And dental benefits have a very limited scope, and explain what that is. And this is beyond the scope of dental benefits. Now, if it pays something and helps out, that's great. And we'll do everything we can to help you maximize those benefits. But they're going to be limited in scope, just so you know.
Yeah, well, and it's a much better way. I like that a lot, because it's a much better way of putting it than it's a coupon, which is in essence what it is.
Right.
But you don't want to call the patient an idiot. Well, you just bought a coupon book. So
exactly. I'll tell you, right to your point, I think I say this in the book, and the first dental benefit program in the United States came out in 1954, a long, long time ago, and it paid $1,000 a year. Now, 2026, 27 as we go forward, if dental benefits had kept up with inflation, the average dental benefit program would now pay $11,000 a year.
Not even close.
So nobody's ever done the math before that I know, but I find, well, I wonder how this would translate. It didn't translate well. So when the patient says, my insurance company says your fees are too high, well, I don't think the patient wants 1954 dentistry.
Yeah, we could do that if you
dentistry. Want. Yeah, so it's an interesting thing. We understand where the lag is here, but so I think some of the verbal skills would be one of the answers I'd give you. I think talking about value for the dollar is a big deal. What somebody gets out of it. I quote Jeff Bezos a lot of times when I lecture. He was asked once, well, you were the great visionary. What do you think is going to happen in the future? What's the future of business, Mr. Bezos? His answer was brilliant. He said, I don't know. I can't predict the future, but I'll tell you one thing, you're asking the wrong question. You shouldn't ask what will change. You should ask what will not change. And what will not change, one of the things he said is a great emphasis on customer service and value for the dollar. And if people understand what they get out of it, it sounds so simple. It sounds so incredibly simple, but it's not. There's a lot of discussion that has to go into this to make this work.
So give me an example of a conversation around value.
Sure. I have what I call 5 pillars of value, if I can remember them: prevention, health, function. What else do I say? Profession, health, function, aesthetics, and I guess I would say quality of life. So if you put those down, somebody comes in and says, I'm missing a tooth in the back of my mouth. And I know you want to fix it because you're a dentist and it's driving you nuts. It's not there. But I got to tell you, if you do a whole implant and tooth and everything, that's going to cost me a lot of money. Nobody sees it. Nobody cares. So why should I spend the money? So how do I, as a dentist, explain the value of this procedure? Well, and I'll be brief, but one of them is a prevention message, because if you're missing one tooth, you start to have shifting teeth. And you can put this in layman's term, but super eruption of opposing teeth. And that's a problem. So that's prevention. Another thing you end up with is therefore a functional problem, because everything's moving and it's not supposed to, and the bite gets thrown off. You could end up with an aesthetic problem, because a one-tooth problem could create a cascading effect, and you could have something in the aesthetic zone when all is done. You get into those kinds of issues. And certainly you could get into all the aesthetic issues, and the health issues come down to teeth that are too close together and out of position, are harder to clean, harder to floss. You're more susceptible to decay and periodontal disease. So when you put all these things together, what we're really talking about, Mrs. Higginlooper, is a quality of life issue. And by replacing one tooth, we avoid a whole mouthful of problems, which gives you all the benefits we just talked about. So that's a value proposition.
So let me ask you a question around that then, because I love the way you brought that back to a singular point. You addressed multiple there, but you brought it back to a singular point of quality of life. In your opinion, do you find that as effective, more effective, less effective than being genuinely curious? Like, Mrs. Higginlooper, why did you come in today about that missing tooth? What bothers you about it?
Oh, it's both, obviously. I mean, we have to there's a great interview process, and what motivates you. I always say, when somebody shows up, maybe they haven't been to a dentist in years, and all of a sudden they show up, it's a window of opportunity. The window just opened. And if you don't hit that window, it's going to close. And if a patient's not in pain, they may not go seek care for another 3 or 5 years. So why? We had one man who called an office and said, well, I'm 60 years old. My adult children gave me a cruise. It's coming up in 6 months, but I understand that when you go on a cruise, you're supposed to get a lot of pictures taken. You're supposed to eat a lot of food. And the way my mouth looks, I can't do either one. Can you help me? Sure, we can help you. And then it's like, well, but the benefit will be not just the days of the cruise eating, and the benefit won't just be the photos, which was a wonderful benefit. The benefit's going to be all the health benefits, and the fact that, it will basically improve the quality of your life for the rest of your life.
Yeah, you add weights to that positive side of the scale for them while addressing their individual need. So yeah. Do you believe curiosity can be taught, or is it innate? Meaning, I've got a bunch of team members, and I've got 2 or 3 who just naturally ask those questions, like I've never had to train them. Can the others be taught to be that way, or is that just human nature and we can't fix that?
No, a lot of things can be taught. And certainly, people ask me about scripts all the time. And it's not, when I say scripts, it's not, hello, Mrs. Higginlooper, how are you? It's basically talking points, right? But yeah. If you know how to do an interview, you know your talking points, you know what to say when somebody throws an objection your way, yeah, people can be taught to bring people out. This may sound like the smallest possible thing, but I've seen offices where the assistants are fantastic, but they go out and pick up the patient in the reception area, and they walk them back. And sometimes that conversation is fine because the patient's friendly and outgoing. Sometimes the patient's quiet. Sometimes they're nervous. And sometimes those conversations aren't going great. So if we can tell people how to break the ice and talk to them and say, how was your drive over here? Oh, did you have to come very far? Yeah, well, I live over here. Well, I live over there too. And all this. Next thing you know, we're having a little bit of a conversation, a little icebreakers. And then let me tell you what's going to happen today. First of all, the doctor's going to come in. He or she is fantastic. But let me just tell you a little bit about what's going to happen. Now the patient's starting to relax and engage and have a little conversation. So yeah, they can be taught. And a great deal of what I do is teaching just that.
Yeah, brilliant. Okay, so that's 2. What's the third takeaway?
I think one of the things that happens a lot in offices nowadays is I've got practices calling me saying, I want to get off of this insurance plan. And how do I do it? Now, I never tell anybody, hey, I've looked at your practice, get off this insurance plan. I don't do that. But what I do is say, if you've made the decision, I'm going to help you do it. And the reason it's so important now is the gap between what insurance pays and what it costs to run a practice is wide. A couple of years ago, we had 9% inflation. So that gap got wider. Now the inflation isn't so high, but every new point of inflation is on top of the old inflation. So it's a wide gap. So I've got people calling me and say, I can't do it anymore. So one of the things I tell you is what not to do. What you don't do is write a letter to all your patients saying, we are dropping this insurance plan, just to let you know, wanted to give you a heads up, because as soon as you say that, they think they've been thrown out of the practice. So we approach it very systematically, and we tell patients as they come in. And we say, we held out as long as we could. But in order to provide the quality of care that meets our standards, we're not going to be able, keyword, not going to be able to work directly with this plan anymore. Now, you'll still be able to use it. You'll still be able to get some benefits, and we'll help you maximize your benefits, but we are going to have to go out of network with it. So I just wanted to let you know what's going on and give you a heads up. And you can ask any questions, and we'll be glad to answer them for you. And now, the next time you come in, we'll still accept it, but the time after that. So I'm just trying to and we'll talk about it as you go through. So we prepare people, and then we let them know in writing and really have conversations with them. And some patients say, well, I'd be crazy to come to you because I can get my cleanings free somewhere else on my plan. Okay, but if you need something beyond that, the door is always open. You trust us to do something a little bit more complex, we'll do it for you. It's a once in a lifetime thing. But whatever you choose to do is fine, and whether you want to come back and forth or go someplace else, whatever you do is fine. But we just want you to understand that I'm not going to do dentistry for you I wouldn't do for my family, and we just can't compromise our standards.
Yeah, love that. And what you're doing in that scenario is not allowing the patient to fill in the blank spaces. If you send them a letter and saying, we're dropping the insurance, but we'd love to have you stay with us, they're filling in the blank spaces. Oh, he's mad at me, she's mad at me, whatever it is. They'll make it up in their head, and to your point, they think they're being booted out of the practice. But you need that. Script is a great word, and you're right, it's not a reading from a script, but it's talking points, it's bullet points to address those issues. And that takes practice, that takes repetition. Like, I don't think I could go to one of your seminars and then have that insurance conversation with every patient that walked through the door. I would need to personally anyway, I would need to practice that multiple times before doing it with an actual patient.
As much as I love the lectures, and if I could, it's great. I do a lot of consulting, and I do visit practices on site, but I follow up with a lot of Zoom calls. And the way I do it is, let's say you have a practice that's going through this, then I never call it role playing, because role playing is something that makes people nervous. I call it practice, and say, okay, you don't want to, if you were in a Broadway play and you didn't rehearse and the curtain went up, you'd be really nervous. So let's rehearse while there's nobody watching but us. And I'll just say, I'll be the patient, and and we go back and forth, and I always say, hey, you did this right, you did this right, you did this right. And is there anything that you think you could have improved? Well, I wasn't sure about what to say here or there. All right, then we'll help you with that. So it's a lot of positive reinforcement, and people start developing confidence, and they say, hey, you're doing great.
And I think from the standpoint of a worker, a person in a practice, if we can shift the mindset from I'm being criticized to I'm at spring training, right? The Aaron Judge goes to spring training every year for baseball, and he sits there with his batting coach, Dr. Schwab, who says, this is working, this is working, this is working. I want you to open your stance a little. I want you to try this. I want you to try that. It's corrections for performance, not Aaron Judge, you suck as a human being. And if people could think about role playing and that kind of stuff as spring training, working with you individually, I think that would make a big difference in the way they approach that kind of coaching.
I'll let you in a little secret, Greg. I sometimes feel that I am breathing rarefied air because I get to deal with some outstanding practices, Seattle Study Club practices. All right. And I really don't know what the average dentists are like sometimes because I'm very privileged and blessed to do this. But you know who contacts me and I get these emails, these phone calls. They go to my website, davidschwab.com. There's a little box, they fill it in. It's the really excellent practices. I've had practices. I said, well, your production is fantastic. Your practice is, what do you want me to do? And they said, well, I got to get a little better. And it's kind of like the golfer who wants to take one stroke off, right? Even though they're already really up there in terms of leaderboard. So it's the best who want to get better. And that's why they're so darn good, because they're never satisfied. They're trying to get a little better. The train wreck practices, I never hear from them.
Yep. The value of compounding incremental change. There's
that's it. That's what it is.
It's huge. It's huge. So we will link to the book in the show notes, but where can people get it? Is it Amazon, Barnes and Noble, bookstore.com?
It's on Amazon, it's on Barnes and Noble. It's in physical form. It's in electronic form, your iPad, your Kindle, whatever. But actually, if they just go to my website, davidschwab.com, I put it right up at the top so people could see it and link to wherever they want to go to order the book. And I also love comments. People call me and say they read this chapter and they want to talk about it, whatever. That's always fun.
Yeah, so. Let's shift gears a little. You speak all over the country, well, all over North America, right? Canada as well, to a variety of dental audiences. What are you getting asked by those audience members most often? What questions come up for you most often?
I think they want to know where the profession's going. I mean, they say things like, well, we've got fee-for-service practices. We've got, and I include practices that take insurance in that, but we've got fee-for-service practices. We've got practices that seem to be heavy insurance. We've got corporate practices. We've got specialists who are itinerant specialists, and we've got corporate practices that have an in-house specialist. And wherever they are, whether they're a general dentist or whatever they are, they say, what's going to happen to the profession? And I say, well, I don't know exactly, but I think I have a little bit of thought about this, which is that I don't think one model is going to chew up the other model, and we're just going to be left with one. I think we're going to be left with a variety of models. So if you can find a model that works for you and you're happy with it, I don't think you're going to go extinct. The only thing that is a little bit shaky is if you want to start a solo practice from scratch and always be a one dentist practice. That's hard to make that work economically. Nothing's impossible. And if you've been doing it for 30 years, you may be able to coast to retirement and be fine. But getting out of dental school, hang out your own shingle, buying all that equipment, and doing it without ever having another dentist in there to turn the crank is difficult. But if it's a group practice, and a group practice can be two dentists, that's fine, then the economics work a lot better. But whether you choose, whatever practice model you choose, you can make it work for you.
Yeah, and we've got a number of members and a couple of brand new directors who have actually opened from scratch. So you're right. It's not impossible, but it is a heavier lift than it was in the 80s and 90s and early aughts.
And it's like lifting off, from the Space Coast. Once you get the initial lift, it gets a little easier. Instead getting off the pad, that's going to be a little hard.
Yeah, for sure. All right, let's finish with this. Let's bring this full circle to your Jeff Bezos comment.
Mm-hmm.
What's the future look like? Don't ask me what's going to change. Ask me what's going to stay the same. What's not going to change in dentistry in the future?
Well, a very famous guy by the name of Dr. Michael Cohen once said to me a long time ago, he said, it's all about relationships. You and I have heard this about a billion times. And,
Yeah.
and it turns out, Greg, what do you know? He was right, right? Yeah.
So annoying.
I know. That's why he's annoying to be around. He's always right. But anyway, it's true. It's a relationship business, and I think that what we have to understand is, I talk about this even in the first chapter of the book. You got to get past the dental cliche model. You've got to realize that when somebody comes in, everybody knows this because they live it every day in a dental practice. Oh, patients can be nervous. The dentist is the last place they want to be, but if I use the analogy with the magician, if you don't have the showmanship, if you don't have the connection, if you don't put the effort into it, there's no rabbit in the hat. It doesn't work. And so you don't want people, you said something really good earlier. You said about you don't want the patients writing it. No, this is not a blank slate where patients get to write their impressions. This is a focused marketing campaign internally where we tell you what you think about us, but we walk the talk. We don't just tell you, we do it. So we want people, one of the great things that I've learned over time is, and I think this is a Walt Disney quote, he said, when people come to my parks, I don't do a survey and say, oh, gee, I hope I get good reviews. He said, I figure out what I want on those reviews. And then I create an experience. And then they say all the words that I was hoping they would say because that's the experience. And if I don't get exactly what I was hoping for, I tweak the experience. So we want people to say, this place was fantastic. They were caring. They were wonderful. They were nice. They took the time to explain things to me, and they gave me a great smile or whatever. They took care of my problem, and I can't wait to tell all my friends about it. Well, if that's what you want, then what behaviors do you have to exhibit to get that kind of a review?
Oh, I love that. What a great way to close. So, David, thank you for spending a few minutes with us this afternoon. I hope you enjoyed your beer. I enjoyed.
Oh my goodness, yes, I do. I love your format. I love what you do, and we should do this more often, just to talk and reminisce.
Absolutely, absolutely. Most of our conversation would bore people to tears, but you and I would have fun.
Yeah, we would entertain each other, I'm sure.
But I want to encourage everybody listening or watching to check out David's new book. It's very strong. It's riddled with takeaways that you can use immediately. I would encourage you to think about bringing him into your club. Phenomenal presentation. The team will literally, their stomachs will hurt. They'll laugh so hard. It's really good. And if you want to meet David in person, he's at Symposium every year. So come join us in Marco Island.
Yeah, I'll be there in January. You had the courtesy of putting it in Florida in 2027, which was very nice of you.
Right in your own backyard. Right.
I've been to lots of
backyard.
places, but yeah, if you go to my website, davidschwab.com, that's how you find me. And obviously, I have lots of conversations with people, not because I got hired to do anything, just because somebody called me. And what do I get out of it? I learned something from it, and I think it's really fun. So I'm the easiest person to find.
Brilliant. Thank you, David. Cheers.
Thank you, Greg. Cheers. Yep. Bye now.